The Prime Minister has told Sky News she does not accept there is a humanitarian crisis in the NHS. Theresa May told Sophy Ridge on Sunday that there are huge pressures in the health system but they are recognised. It followed the head of emergency charity the Red Cross defending his earlier comments that the organisation was on the front line, responding to the humanitarian crisis in our hospital and ambulance services across the country. Mrs May told Sky's New Politics programme, "I don't accept the description the Red Cross has made of this. Yes, there are huge pressures on the NHS, but first of all we should thank all the dedicated professionals in the NHS who have been working so hard over what is always a difficult period in terms of the number of people using the NHS, the Christmas and New Year period." She added, "Yes, there are significant pressures, but we recognise those pressures. We asked the NHS a while back to set out what it needed over the next 5 years in terms of its plan for the future and the funding that it would need. They did that, we gave them that funding, in fact we gave them more funding than they required. So funding is now at record levels for the NHS, more money has been going in." Jeremy Corbyn has demanded the PM comes to the Commons on Monday to set out how she plans to fix her failure on the NHS. Mr Corbyn said the situation in hospitals in England and Wales was a national scandal and the NHS crisis was unprecedented. He went on, "People are lying on trolleys in corridors waiting to be seen. Hospitals have had to close their doors, unable to admit patients. The health service is at breaking point. But this crisis is not due to an outbreak of disease. It is a crisis made in Downing Street by this government, a crisis we warned them about." Red Cross Chief Executive Mike Adamson told Sky News he was not trying to embarrass anyone by his comments about a humanitarian crisis, but hospitals are feeling the pressure amid increasingly chaotic situations. He said the phrase was justified because those the charity had spoken to feel like they are in crisis as they are not able to get the assistance they need. The aid organization was called in to help people leaving hospital who do not have friends and family for assistance, to get back on their feet. Mr. Adamson also claimed